So, having seen about HbA1c in detail, we looked into what are all the various factors which can affect the HbA1c, how we can use HbA1c into our clinical practice. Now, we will move on to the next important monitoring device, that is self-monitoring of blood glucose, which we commonly called as SMBG. So, SMBG is very simple. We all know that, and everybody, even in the most rural setup, we can see people have now access to this glucometers. So, very simple, very convenient. All that you need to do is you have to just poke the strip being inserted and take the blood and put the blood sample over the strip, and that gives the reading. It is as simple as that. But is it that simple as we think, or is it much more the finer nuances that we need to know in our clinical practice is what we are going to see in the next 30 minutes or so. So, as we said, self-monitoring of blood glucose or blood glucose monitoring is an essential component of all current diabetes regimens. So, without doing these self-monitoring of blood glucose, it might be very difficult both for the patient as well as for the clinician to interpret what is happening to the patient as far the glucose control is concerned, and to put it into meaningful therapeutic as well as the meaningful outcome of the patient glycemic control is concerned. So, SMBG is a simple blood glucose level measurement carried out with the help of the glucometer. The goal of self-monitoring of blood glucose is collect the detailed information about blood glucose levels at many points to enable maintenance of a more constant glucose level by more precise regimens. It is as simple as that. So, are we looking at these goals, and is it as simple as we think, is the one which we are going to see in this module for the next 30 minutes as we discussed. So, SMBG, as we have learnt over the past 40 years, we have been using this blood glucose monitoring with SMBG. So, in this particular study, which was done in about 1,000 odd patients were recruited to this study. So, especially in the type 1 diabetic patients, as you see in this chart, people who have not used SMBG at all. So, as you see, the HbA1c of these people who are recruited, it involved type 1 diabetic patients. This shows the people who are not using any HbA1c at all. The next column shows people who are using HbA1c less than daily. Occasionally they were doing. And this chart shows the HbA1c of the people who are doing daily and at least 3 times daily. So, when the people were using the self-monitoring of blood glucose, they become aware of what is happening to their glycemic control is concerned. So, the way they consume the food, the way they exercise, the way they monitor or titrate their insulin becomes much more productive and effective, whereby this sort of change, this behavioral change is bringing down a drastic reduction in the HbA1c, as you see in this chart, by more than 1% or 1.5% who use regularly, more than when they are using especially 3 times daily. Their blood sugar control was fabulous. The way they avoid their hypoglycemia is very good. They are not defensive snacking. Their glycemic control is good. They are doing very well as far their A1C control is concerned. So that is what the self-monitoring of blood glucose is bringing to the big change in the way the management of diabetes as for the type 1 diabetic patients are concerned. So, fantastic and fabulous results brings about a very good reduction in the HbA1c just by using of self-monitoring of blood glucose. So, very good. So, then is it only for type 1 diabetics or patients on insulin or even patients on oral hypoglycemic agents is the one that comes into question. We will just see 2 patients where the stand on SMBG for these patients we can know easily. So, we'll take Mr. John, who is 48-year-old man with type 2 diabetic. For the case discussion, he was started on metformin at diagnosis. Then over the last 2 years, the dosage was increased and eventually the patient was added on glipizide. And he's at the maximum tolerated dose of glipizide, and his maximum dosage for both the drugs, glipizide and metformin, is attained, and his HbA1c is 7% today. If no change in therapy is made today, what is the likely likelihood that it will be above 7% on his next visit? The question is very, very simple. The patient is being put on the maximum dose of metformin and the maximum of sulfonylurea that we use in this patient study is glipizide. He is using these maximum tolerable doses. His HbA1c is 7 as of now. So, if you are not going to make any change in the therapy today, during his next visit, it could be just after 6 months, it could be after a year or even more than that. What are the chances that his HbA1c will be more than 7%? We'll just take some evidence, look at some random article to look on what will be his HbA1c when the patients are on metformin and sulfonylurea for the maximum dose when they are on, and what are the chances of them having the HbA1c at the same level during the next visit also. So this is a random reference which we took. So this particular article showed the 579 patients on metformin who added either sulfonylurea or they were added on TZDs. The mean HbA1c was about 8.2% and 64% of the patients had an HbA1c of more than 7, and they were able to reach the target. The 65% of the people, the HbA1c mean was 8.2 and 65% of the people were able to reach a target HbA1c of about less than 7 with the addition of second drug, like what we see with Mr. John, who had a metformin on higher dose and he was added on sulfonylurea and his HbA1c was brought to less than 7. But what this trial particularly showed is 41% of the patients who achieved an A1C of less than 7 lost that control within an average of 1.3 years. So what is the reason that they lose their control within 1.3 years? So if they are going to lose their control within 1.3 years, that means that we are losing the patient's control during this period. 40% of the people, if they are not monitored for next say about 6 months or 1 year, or typically if the patient typically comes on their maximum dose of metformin or sulfonylurea, if they are going to come within the next 1 year, the control of 7% will be lost in 40% of the patients.